Imagine for a moment. A quiet morning. You wake up, perhaps a little stiff, but ready to start your day. You head to the bathroom, a routine as natural as breathing. But what if I told you that a seemingly innocent, incredibly common habit you might be doing in that very room could be silently, dramatically increasing your risk of a stroke by a staggering 300%. It sounds unbelievable, doesn't it? A simple, everyday action turning into such a potent threat to your health and well-being. For many of us, especially as we get older, trips to the bathroom can sometimes be less than comfortable. There's often a struggle, a feeling of urgency, and the temptation to just get it over with by pushing a little harder. This isn't just an inconvenience. For too many seniors, it's a painful reality, a source of quiet discomfort that they might not even realize is linked to something far more serious. This struggle, this one specific habit, is a hidden danger, a silent contributor to a risk that no one wants to face. It's not something we talk about openly very much, but it's crucial that we do. In this video, we're going to pull back the curtain on this often ignored bathroom habit. We'll explore exactly what it is, why it's so incredibly dangerous for your heart and brain, and most importantly, what simple, practical steps you can start taking today to protect yourself and dramatically lower your stroke risk. You'll discover how making small, thoughtful changes in your daily routine can lead to a healthier, safer life. Watch to the end for something that will truly surprise you, something that can make an immediate difference. Now, let's get right to it. The bathroom habit we need to talk about, the one that can dramatically elevate your stroke risk, is something almost all of us have done at some point, straining forcefully during a bowel movement. This isn't just about discomfort. It's about the intense physiological changes that happen inside your body when you bear down with all your might. When you strain, you're essentially performing what doctors call a Valsalva maneuver. You're holding your breath, tightening your abdominal muscles, and pushing with significant force. Think about what happens when you try to lift something incredibly heavy, or even blow up a very stubborn balloon. Your face might turn red, your neck veins bulge, and you feel that immense internal pressure build up. That's a good mental picture of what's happening internally. This Valsalva maneuver creates a sudden and dramatic surge in blood pressure. Initially, when you bear down, the pressure inside your chest increases, which temporarily reduces blood flow back to your heart. Then, when you release the strain, your heart has to work much harder and faster to compensate, sending a powerful gush of blood through your arteries. This rapid fluctuation, this sudden spike followed by an immediate rush, puts tremendous stress on your entire cardiovascular system. For a healthy young person, their arteries and heart might be able to handle this occasional stress. But for seniors, whose blood vessels might already be a little less flexible, perhaps narrowed by plaque buildup over the years, or who might have existing conditions like high blood pressure, this sudden pressure can be incredibly dangerous. Imagine your blood vessels like old garden hoses. Over time, these hoses can become stiff, brittle, or even have blockages inside. If you suddenly blast a high volume of water through that old hose, it puts immense strain on its walls. It might even burst. Similarly, that sudden surge in blood pressure from straining can potentially dislodge a clot that's already formed in an artery, sending it straight to the brain and causing an ischemic stroke. Or, in rarer but equally devastating cases, it can cause a weakened blood vessel in the brain to rupture, leading to a hemorrhagic stroke. This isn't some far-off, abstract risk. It's a direct, measurable consequence of repeatedly putting your body under such stress. And because this is a daily habit for many struggling with chronic constipation, that repeated stress adds up. It's particularly risky for anyone who has pre-existing conditions that might already compromise their cardiovascular health. If you've been diagnosed with high blood pressure, heart disease, or have a history of mini strokes or transient ischemic attacks, known as TIAs, this straining habit is like playing Russian roulette with your health. Even if you don't have these diagnoses, simply being over 60 means your blood vessels have more years of wear and tear, making them inherently more vulnerable. The statistics are chilling. Research has shown that the act of straining during defecation can temporarily increase the risk of a stroke by a staggering 300% in susceptible individuals. It's not just a momentary inconvenience. It's a critical moment where your body is under extreme duress. So, understanding this risk isn't about scaring you, but about empowering you with the knowledge to protect yourself. The good news is, while the risk is high, the solutions are often simple and within your control. We just need to understand why this happens and what to do about it. The first step, of course, is recognizing that struggling with constipation and resorting to straining is not just normal for seniors. It's a red flag that needs attention. It's often a sign that something in your diet, your hydration, or your lifestyle needs a gentle adjustment. Now that we understand the very real dangers of straining, let's talk about why so many seniors find themselves in this predicament in the first place. It's rarely about just one thing. Usually, it's a combination of factors that contribute to chronic constipation, leading to that risky bathroom habit. One of the biggest culprits, and often the easiest to begin addressing, is what we put into our bodies, or more accurately, what we don't put into them. Our diets, as we age, often shift. We might eat less fiber-rich whole foods, either due to changes in appetite, dental issues, or simply out of convenience. Fiber is like the natural sponge of your digestive system, absorbing water and adding bulk to your stool, making it softer and easier to pass. Without enough fiber, things can get pretty backed up. Think of it like trying to push dry sand through a pipe. It's much harder than pushing wet. Clumpy sand. Another key factor, which goes hand in hand with fiber, is hydration. Many seniors don't drink enough water throughout the day. Sometimes it's because they don't feel thirsty as often, or they might limit fluids to avoid frequent bathroom trips. But insufficient water intake means your body will pull moisture from anywhere it can, including your digestive tract, making your stool hard, dry, and difficult to pass. Imagine that dry sand again. But now it's practically concrete. It's going to be a real struggle to move. So, the very first foundational step to preventing straining and safeguarding your health is to focus on these two pillars: adequate fiber and proper hydration. Let's talk practicalities. When it comes to fiber, aim to gradually increase your intake of fruits, vegetables, whole grains, and legumes. Think about starting your day with a bowl of oatmeal or whole grain cereal. Add a handful of berries to it, snack on an apple or a pear with the skin on. Include a generous serving of colorful vegetables with your lunch and dinner. Lentils, beans, and chickpeas are also fantastic sources of fiber that can be easily incorporated into soups, salads, or stews. Remember, this isn't about a sudden, drastic change that might upset your stomach. It's about a slow, steady increase to allow your body to adjust. Listen to your body and introduce these foods gradually over a few weeks. And for hydration, it's not just about gulping down a huge glass of water all at once. It's about consistent sips throughout the day. Keep a water bottle or a glass of water nearby wherever you are, by your favorite armchair, on your nightstand, or on your kitchen counter. Try setting gentle reminders on your phone or associating drinking water with other activities, like taking a sip every time you watch a commercial break, or before and after each meal. Herbal teas, diluted fruit juices, and even water-rich foods like cucumber and watermelon can contribute to your daily fluid intake. Remember, caffeine and alcohol can actually be dehydrating, so factor that into your overall fluid balance. Aim for clear or pale yellow urine as a good indicator that you're well hydrated. These simple dietary and hydration adjustments are powerful tools, often overlooked, that can make a world of difference in the consistency of your bowel movements, making them softer and much easier to pass without any need for straining. But these aren't the only pieces of the puzzle. Your daily movement, or lack thereof, also plays a significant role. Beyond diet and hydration, our daily movement, or lack of it, has a profound impact on our digestive health. When we're active, even with gentle movement, it helps stimulate the natural contractions of our intestines, known as peristalsis, which moves food along the digestive tract. Think of it like giving your bowels a gentle massage from the inside out. Unfortunately, as we age, many of us naturally become less active, spending more time sitting or resting. This sedentary lifestyle can slow down digestion considerably, making stool transit time longer, allowing more water to be absorbed, and leading to harder, more difficult to pass stools. So, the next vital step in breaking this straining habit is incorporating regular, gentle physical activity into your routine. This doesn't mean you need to hit the gym for intense workouts. Simple activities like a daily walk, even if it's just around your house or garden, can make a huge difference. Aim for a brisk 15-30-minute walk most days of the week, if walking is challenging. Consider chair exercises, gentle stretching, or even just marching in place while watching TV. The key is consistency and finding something you enjoy that keeps your body moving. Even light housework, gardening, or dancing to your favorite music can count. The more you move, the more your digestive system moves, and the less likely you are to experience that uncomfortable backup that leads to straining. Another crucial, yet often overlooked, aspect of healthy bowel movements is your posture on the toilet. It might sound strange, but the conventional sitting position on a toilet isn't the most natural or efficient for bowel elimination. Our bodies are actually designed to squat for easier bowel movements. Squatting helps to straighten the colon, allowing for a smoother, less strenuous passage. While a full squat might not be feasible or safe for everyone, you can mimic this position to some extent by using a small footstool to elevate your knees above your hips when you're on the toilet. There are even products specifically designed for this, often called toilet stools or squatting aids. This simple change in elevation can significantly reduce the need to strain by naturally aligning your colon for easier evacuation. It's a small adjustment that can yield surprisingly big results. Finally, it's important to be mindful of medications. Many common medications taken by seniors, such as pain relievers, iron supplements, certain antidepressants, and some blood pressure medications, can have constipation as a side effect. If you suspect a medication is contributing to your constipation, do not stop taking it on your own. Instead, have an open conversation with your doctor or pharmacist. They may be able to suggest an alternative medication, adjust your dosage, or recommend a safe and effective stool softener or laxative to use temporarily. The goal is to address the root cause of your constipation, not just treat the symptom with aggressive straining. You see, tackling that one dangerous bathroom habit isn't just about avoiding a temporary discomfort. It's about making a profound, positive impact on your stroke risk and your overall cardiovascular health. It's about protecting your brain and your independence. Every small step you take, drinking an extra glass of water, taking a short walk, adding more fruit to your plate, adds up to a significantly healthier you. You are empowered to make these changes. They are within your reach, and the benefits for your health and well-being are immeasurable. If you found this information helpful, please share your thoughts or experiences in the comments below. We'd love to hear from you and build a community around healthy aging. Don't forget to give this video a thumbs up if you learned something new, and subscribe to our channel for more practical tips and insights on living your best life at every age. Your health is your wealth, and with these simple adjustments, you can continue to live a vibrant, fulfilling life, minimizing risks and maximizing joy. Live your best life at every age.